So hello everyone, my name is Liyuan Zhu, and before the presentation, I want to say thank you to Dr. Windsor for her support. Without her support, we can't not make this internship achievement. The topic of this presentation is early detection of dementia, opportunities for modeling home sensor networks. Here are my outlines. First, I want to introduce the dementia and its related digital biomarkers. Then I'm going to talk about possible solution, the mobile wearable devices, and a home sensor system. Finally, I'm going to talk about the validation study and our conclusions. So, dementia is a neurodegenerative disorder usually occurring in elder adults. The early diagnosis is critical to the medical intervention, but it's still challenging, especially in the early stage. Dementia, the people living with dementia around the world is increased dramatically in the past and in the future. The total number of dementia in US is more than 5 million, but this number may increase by 50% within the next 10 years. One of the 3 adults may die because of dementia, and millions of people spend billions of hours to provide care to dementia people. Dementia also have a huge economic impact. The total payment in 2020 for people with dementia in US is around 300 billion, but in the whole world, it's more than 1 trillion. So it's necessary for us to provide a solution to detect and prevent dementia. So here are some foundations with the development of Internet of Things. There are some possible solutions. One is the mobile and wearable devices, and another one is smart appliances, which provide a potential foundation to our solution. And we are going to focus on those mobile devices and home sensor system for the detection and prevention of dementia. Our target audience is elder adults and other people with dementia risks. Before talking about those systems and wearable devices, I'm going to introduce the hallmarkers of dementia. Mostly, the hallmark of dementia is impairment cognitive functions. This cognitive function impairment is often preceded or accompanied by deterioration of emotion control, social behavior, motivation, and physical functions. All those hallmarkers can be detected with those wearable devices and other sensors. So in order to have a better understanding of those digital biomarkers, we provide a systemic summaries of clinical monitoring and sensor literature to generate a list of tables which affected by dementia and example metrics to measure and make a comparison between the mobile and wearable sensors and home sensors. Obviously, we notice that the home sensor can capture most metrics which measured by the mobile and wearable devices. On the other hand, we can see the home sensor have another advantage by capture the home utility using patterns, which can collect data in a passive way without the need to remember to use a wearable or other devices. The home sensor can monitor usage patterns for water, gas, and electricity, which can detect dangerous and anomalous behaviors and provide an alert to the users. Here are some brief introduction of the mobile and wearable devices. Those sensor and health-related information include, but not limited to, those microvolve, which can measure voice and other noise. The touch screen can measure figure motor skills and reaction time. The PPG can measure heart rate wearables, blood pressure, the geopositioning sensor, for example, GPS and Wi-Fi localization, can collect location information and access data. The accelerometer can measure activity levels. Due to a variety of data listed in this picture, the mobile and wearable devices can produce a large variety of health-related data, which can contribute a huge possibility in healthcare monitoring. The advantage is obviously, which can provide a highly usage rate among 30 group of people, which is usually in the young teenagers. And wearables devices also have an ability to collect high-frequency data than those traditional tests in a clinic. And wearable devices also are very convenient for the person to monitor it and take it to anywhere they need it. And on the last one is the highly data quality than the traditional test method. However, wearables also have some drawbacks because it's popular. Although it's popular in the young teenagers, many elder adults have difficulty use small devices, and even sometimes they may forget to use them. On the other hand, many people are not willing to use obviously monitoring system before they experience health problems. From a systemic perspective, relying on one device results in a lack of redundancy. If in some cases the mobile devices they are broken or have some problem, you may lose the track of those health data. In order to solve this problem, we propose to use a home-based sensor system, which contains with 4 parts. The first is data hub, which usually a computer protected by a security firewall, which used to collect data from all those sensors, like in this picture, and for storage and analysis, which can just generate a real-time report to the user. The second one is activity sensors, which is a modular selection of passive motion, light, temperature, environmental, and other sensors, which can collect the health-related data for those digital biomarkers, including walking speed, sleep quality, for incident, screen temperature, and speech characteristics. The third one is instrumented objectives. Those objectives, most of those objective indications, for example, the poly boxes, toothbrush, the refrigerator, and other utensils, which can be equipped with some sensors used to track the usage information. And the last one is other digital devices, which include the personal computer, television, and projectors. Those digital devices can track the usage, and especially for the keystroke and movement metrics. The advantage of a home system is they can measure behavior, use those everyday objectives and routines without additional action of the users. So it's very convenient for some people. They may forget to use those wearables, and a home sensor system can solve this problem. Secondly, people with dementia, they may have other undiagnosed medical problem, but they have difficulty to get the help they need. And a home sensor system can help solve this problem. This system can report other medical problems if they need. Lastly, other sensors can not only surveillance on those health-related data, but they also have value for the safety. environmental and consumption monitoring, such as water, gas, and electricity. So this system has multiple usage. It's not only limited to the healthcare. But on the other hand, we also have some consideration of such a home system. Because all those sensors, they are based on the home and equipment, they are not able to measure outdoor activities without the comparison with wearable devices. And furthermore, the prevalence and data protection are critical in those healthcare applications. To reduce such risks, we propose to restrict the data access to trusted users. Second, we storage the health data only in the local hub. Last, we use secure network protocols for data transaction if we need to report some information and report to the healthcare providers. So in the future, we have some validation study are needed. We will conduct a retrospective cohort study based on a 10-year and 5,000 people, 5,000 elder adults, and we are expecting a data sharing agreement, which means we are waiting for a data access, and we are expected to finish the data access for the data analysis by this fall. Finally, is some conclusion of our project. We present a novel and extensive taxonomy of digital biomarkers for dementia. We also proposed that a home-based sensor system can address many demands of elder adults. Finally, it's a practical and promising application of passive sensor with potentials for not only dementia, but also other public health benefits. Thank you, and any questions?
I have a question about cost of these services, the whole system and the digital sensors. Are these going to be covered by insurance, and are they going to be widely available to mainstream populations?
I guess they cannot covered by the insurance because it's a self-built system which can selected by the potential users.
Like, what's like the cost range of like a home system?
I guess it's not too high. It's maybe cheaper than those smart appliances, than other appliances in the house, but it's maybe a little bit expensive than the wearable devices because it's a data center in each system is necessary.
Okay, thank you.
Thanks for your question.
If there are no more questions, I just want to say thank you to Liyuan for presenting with us today and for sharing his work. Thank you so much, Liyuan.
Yeah, thank you so much.